They are diagnoses at near epidemic proportions for kids in this country: ADD and ADHD, attention deficit disorder, and attention deficit hyperactivity disorder. Fair or not, they are so common as to become part of the vernacular, referring to our collective short attention spans and inability to focus. Don't mind him, he's got ADD. According to a member of the American Academy of Pediatrics, when our nation's doctors encounter a patient with one of these disorders, they go right to one drug, methylphenidate. You may know it better as Ritalin. But there is a lesser-known treatment, one that may, in fact, be more effective with fewer side effects. Cannabis. You may know that better as weed, reefer, Mary Jane, marijuana. Dr. Claudia Jensen is a clinical instructor at the University of Southern California and a practicing pediatrician who advocates the use of medicinal marijuana for the treatment of ADD and ADHD. Dr. Jensen, good evening.
Hi, hello. How are you?
This is something you feel strongly about. You even testified before Congress a few weeks ago on the use of medical marijuana. What led you to the conclusion that this is a viable treatment for this disorder?
Well, that's what patients reported to me, so I listened to them. And I started paying attention and asking more questions when I did patient interviews. Seems to be rather consistent. They keep saying it over and over again.
There are parents who are no doubt thinking as they watch this, without any kind of analysis or any kind of medical explanation or the expert testimony of a doctor who has listened to patients, that makes no sense to them. The idea that they are fighting on one front the pernicious influence of marijuana in a teenager's life, a kid's life, and yet you are here saying that this can be of enormous value in treating this rampant and life-constricting disease. How do you respond to people who have the knee-jerk reaction, how could this possibly be any good?
Well, first of all, you're right. This is a potentially life-debilitating condition for a lot of children and adolescents. They become very angry. I think the answer to that question is that it needs to be evaluated by a physician before it's recommended to a child or an adolescent. And the truth is that one of the reasons that adolescents have an increasing use of cannabis and marijuana in this country is because they've been lied to. They've been told that this is a very dangerous drug and that it has no benefit. And unfortunately, that's not what they experience in the streets. And I think it's more appropriate to bring it up out of the streets and into the doctor's offices so that children and adolescents and parents can learn the truth, get some of the data, and look at this drug not with a reefer madness perspective, but more with a scientific and factual perspective.
How would you administer this to children at what age? And I'm presuming that the means of dispensing would be primarily those other than smoking it. Am I correct?
That's what I primarily recommend, particularly with ADD and ADHD, because smoking marijuana has such a short duration. It only lasts an hour and a half to 2 hours. Plus there's the stigma of the child smoking anything, but smoking pot is a difficult social issue to deal with. When they ingest cannabinoids or cannabis compounds, for example marijuana, it lasts a lot longer. They can get all the way through the day with a single cannabis cookie or a piece of toast with cannabis peanut butter in it in the morning before school. They don't have to get stoned, it's dose related, but they do get the benefit of being able to focus and pay attention, not be impulsive, not be angry, be peaceful and relaxed, and pay attention in school, which helps them get better grades, which is the important issue.
Anything would work. Dr. Claudia Jensen from USC, many thanks for your time tonight.
Thank you. Thank you for your time.
Certainly. Before we leave tonight's number one story, one more thing you should know about it. According to Dr. Richard Gorman, the chairman of the American Academy of Pediatrics Committee on Drugs, one of the most prescribed drugs for children is amoxicillin. 1 in 4 children taking it each year. This is an antibiotic commonly used to treat ear infections.
Jeffrey's Journey is a book about using medical cannabis for therapeutic reasons when all conventional methods of medication would not work. Jeffrey was a very violent, angry child, and he has been on numerous medications, had numerous diagnoses from ADHD, bipolar, intermittent explosive disorder, conduct disorder, and again, none of the medications work. So Jeffrey's Journey is about when we took charge of what was going on and put Jeffrey on medical cannabis with a recommendation and how it helped him within 30 minutes.
Now, how old was Jeffrey at that time?
He was 7 years old.
7 years old, and you started him on cannabis.
Medical cannabis.
And what happened?
Within 30 minutes, he was a changed child. And the reason why I say that is because Jeffrey was so violent, he always had to sit in the front car seat with me and hold my hand as we drove. And one morning, it was his first morning of medication. He took it in a quarter of a muffin. 30 minutes later, we were driving down the freeway, and his grip loosened, and all of a sudden he looked at me and smiled and said, "Mommy, my head is not so noisy." I didn't know whether to crash, whether to cry. I didn't know what to do. It was just amazing, and it just stayed with him.
And this was from a boy who could not stay in school, couldn't make friends because
of his anger, and he was very violent towards others.
And so what was the upshot? What happened after he started using cannabis to his personal life?
His personal life had changed tremendously. He began having friends in the neighborhood. He had his very first birthday party at 8 years old, where someone actually came. He had, I think there was 8 or 9 kids there. What medical cannabis did was it helped Jeffrey tame the anger and have time to grow up and develop as a normal child.
And how did this? You said he didn't have friends beforehand because he was so violent and angry. He started developing friends. Did their friends' parents know about his?
Yeah.
And how was their reaction? What was the reaction?
Everyone was amazed, that something was working because they saw the difference, especially our neighbors. They saw the difference in Jeffrey. And so, I told them what I was doing. I wasn't going to not tell them. And they allowed their children to play with him. So
now, you had some problems legally because of, the idea of giving a child, an 8-year-old child, marijuana kind of raises some eyebrows, and you had some problems about that, didn't you?
Absolutely. Again, I was always upfront and honest with what treatment I was intending on doing. And about 6 weeks later, we got notice that I was being taken to court for being an unfit mom, contributing to a minor. And that court case lasted for nearly 6 months, but we did win the fight.
And what did the judge say?
The judge first apologized to us for having us have to go through this and all the time we wasted because of it. The very first court date that we had, he had said that he's never seen a family so supportive with each other, and he was sorry that we were having to go through it. But he did put a stay-put action on it where Jeffrey could stay put, keeping on his medical marijuana versus having to go back to conventional medication, which didn't work because he'd seen his records and how violent Jeffrey was, and he's so good now.
So the court said you keep doing just what you're doing.
Absolutely. It was a landmark case.
I'll say it was. Well, how did Children's Services react when that happened?
They reacted in a way that I would have anticipated, kind of, he. It was like, well, they did see the difference in Jeffrey, so that was a good thing. And they knew I was not harming Jeffrey. Jeffrey was not being harmed in any way.
Now, your source of marijuana came from a group called the Women's Alliance for Medical Marijuana, and they were the ones that were raided by the DEA and closed down, and you lost your source of medicine for Jeffrey. What happened when that occurred? When
that occurred, again, Jeffrey had time to grow up, so he knew what it was like to be normal. And when we could not get his supply, the right supply of what he needed, he started to spiral downhill again into anger and violence. And he was aware of it as well, could not control it. And so eventually we had to Jeffrey had to end up in a residential facility again. But it was a positive thing because, again, with the cannabis, he grew up. And this just worked shaping him, working and shaping him with his behaviors.
Was he ever able? Did he ever go back on cannabis?
No, he never went back on cannabis. Right now, he's been medication-free since the raid.
And do you feel that his use is what you said grew up? Do you think the use is what helped teach him how to behave?
It was a miracle. It was a miracle medication for Jeffrey. It did teach him how to grow up and he get a sense of normality, what it was like to have friends, have birthday parties, be able to function, without getting so angry over one little thing, a shoelace being untied or anything like that.
Does he miss the medicine? Does he say anything about not having it anymore, not using it anymore?
He does not miss the medicine in that sense, but what he is a big advocate for medical marijuana. He's just, he knows that it helped him, and he's very upfront with how it helped him. And it's, it's incredible to interview with Jeffrey and hear, or just talk to Jeffrey about it and the power that medical marijuana has.